They asked me to come today to talk about equine chiropractic. I have an integrated practice, so I do some regular medicine, but I also do acupuncture and chiropractics and some other holistic meds. So if you have any questions along the way, feel free to stop me. But the question is, what is animal chiropractic? It's a holistic approach where we're actually asking the body to try to heal itself. So we look at the internal and external stresses on the organism, and then use in chiropractics neurologic input from the central nervous system to ask the body to correct. So chiropractic is a ton of neuroanatomy. Just a funny cartoon. We don't actually put the horses on tables, as you guys probably know. It would be fun to try. So the idea in chiropractics is that the spinal column and the central nervous system, which is comprised of the brain and your spinal cord, impact the entire nervous system and then the biomechanics of your entire body, including your internal organs and things like that. So within chiropractics, we talk about range of motion, and we look at the normal range of motion of, usually we're talking about your spine, and whether that's within normal limits, is it too much, is it too little, and then we make an adjustment based on what we find as an abnormality within the system. So again, chiropractics is going to focus on proper health and movement of all joints in the body, so that's why sometimes if you guys have seen a chiropractic adjustment, we are picking up their legs, moving their feet, but especially the spine and the spinal column. So it's a little different than human chiropractics, which don't use the extremities as much. We do use extremities in animals. So by definition, by the Motion Palpation Institute, which is the institute that governs human chiropractics, chiropractic is concerned with the relationships between structure, primarily the spine, and function of the nervous system of the body, and how that relationship affects restoration and preservation of health. Okay, so again, in chiropractics, we're looking at the central nervous system, and it's pretty complicated actually. It's not as simple as, a vertebrae is out. The whole neuropathology of it, it's really actually very hard to talk about because it's so complicated. But what are we treating? What we're treating is what are called vertebral subluxation complexes, or VSCs. So that's when you see a chiropractor, a human chiropractor, push down the spine. That's what you're looking for. You're assessing the normal mobility of that area of the body, and then you're deciding if something isn't in place. So it can be up and to the left, it can be up and to the right, or it can be down. So it's actually an entire, that's a pretty, generic way of saying it, but basically it's true. So we as chiropractors believe that movement is health, and that anytime something's not moving, it's not healthy, and therefore we want to always restore normal movement to increase the likelihood of health. And that's similar in Chinese medicine too, is that a lot of the alternative therapies really believe that movement is an integral part of the body's health. So, what is a vertebral subluxation complex? It's an aberrant or abnormal relationship between two adjacent articular structures. So that can be vertebral bodies in the spine, it can be bones in the legs that have a functional or pathologic sequence, causing an alteration in biomechanics and neurophysiology reflections that cause body systems to affect body systems either directly or indirectly. Again, it's pretty complicated. So basically, two things that are supposed to be in alignment aren't, and that affects the neuropathophysiology of your entire body. So this is from a human chiropractic illustration, but you can see these are your vertebrae. So in a horse, it's a human, so it's standing this way. In a horse, it would be standing this way. Anytime you have an abnormal positioning in your vertebral bodies, you're potentially putting pressure on nerves, the spinal column, or the soft tissue associated with that area, which again, we believe affects the entire body, not just that localized area. So it's been from neuroanatomy. Again, this is super complicated, so if you guys have any questions, ask me. That the brain and the spinal cord are the primary pathways, so we know that if you sever your spinal cord, then you become paralyzed. So it depends on where your problem is, how it affects the part of your body. I always think it's interesting in horses, your nerve roots to your back end, in dogs too, are more superficial than your nerve roots to your front end. So that's why, especially in dogs that have disc problems like dachshunds or large breed dogs, that's why you more commonly see hind end paralysis than front end paralysis, even with cervical lesions, because your nerve roots are more superficial to your hind end than your front end. That doesn't seem right. It seems like they should be more deeper because they come off later. But so the pathways of the nerve impulses move to and from the brain through your central nervous system. An abnormal positioning of the bones in your spinal column can affect the pathways, causing problems with not only nerves, but bones, muscles, and soft tissues, which over time can lead to degenerative changes within the body. So what types of things are we looking at? We're looking at, I really sound smart now. So spinal kinesiopathology, which is basically abnormal motion of your spinal bones, okay? We're also looking at neuropathophysiology, which is abnormal nerve function, like a pinched nerve. If you guys have ever, you're riders, right? You have sciatic problems. If you get a pinched nerve in your back, you get tingling down your leg. Why can't it happen to animals too? And what we've shown is that it does. So myopathology, which is abnormal muscle function. So if you affect the nerve, you affect how the muscle contracts and relaxes, and therefore that muscle may not work properly, it may fatigue earlier, you may get swelling. If you guys have ever seen horses that have had a bad accident, sometimes they'll have abnormal sweating on a side for no apparent reason. That's because they have nerve dysfunction. Okay? Histopathology, which is abnormal soft tissue function. So now we're talking about discs, ligaments, connective tissue, which leads to pathophysiology, which is just abnormal function of the spine and the body over time. So what we're saying is if you have chronic malalignments, the vertebral subluxation complexes, that affects your soft tissue, your muscle, your nerves, over time your bone, leading to other things like arthritis. So what do you do about it? You're gonna go, if you're a person, you're gonna go see a chiropractor. If you're a horse, you're gonna hopefully see a vet or a chiropractor who's been trained in chiropractics, and you're gonna have someone out and they're gonna do an exam. And the exam should include posture analysis. How's that horse hold itself? And these are just pictures I took from Coggins. You know, these are just pictures of people's horses that I took that were standing for Coggins pictures. And because I was like, my posture pictures? And then I was like, I have Coggins pictures. But it's really interesting when you go through, look how this horse is standing. Like, why is it standing like that? And it was in all of his pictures. And then this is my horse. Like, why is he standing all tucked up underneath himself? You know, and I mean, if you look at them, and you really look, a lot of times when you stop your horse, they'll chronically point a front foot or a back foot. This horse always stands off his right hind, you know? And if you really look, almost always they do something weird, you know, or they'll cock their head to the side. And that can all be indications of subclinical discomfort. I'm not talking about head bobbing lame, just subclinical discomfort. So then, most of the time, we'll at least watch the horse walk. If I haven't seen a horse before, I'm probably going to put it on a lunge line, and I'm going to watch it walk, trot, and canter. At least the first time that I've seen it, you know, after I ask what the complaints are. So, you know, I will watch them at all different phases of motion, at least the first time I see them ideally. So we're looking for, obviously, lameness, you know, lack of coordination, pacing or stumbling. I'll always stand them up square and look at muscle symmetry. You'll be amazed if you really look. How many horses aren't symmetric left to right? They're not the same. And sometimes it's really bad. And sometimes it's a minute difference. You know, do they have a shortening in stride? Do they not come through all the way behind? You know, the dressage riders, they have super sensorial muscles in their butt cheeks, and they can tell that the left hind isn't coming through quite as, you know, as well as the right hind. And most of the time, they're right. You know, what you feel as a rider is probably right. The other thing I see a lot of times is that a horse will hold its head more cocked to the outside in one direction on the lunge line than the other direction. You know, all those things, again, are subtle suggestions. So that something might be not quite right in how that horse is going. So we also are probably going to move as many parts of the horse as we can. And a lot of times I'm talking, you know, and I'm going through and I'm touching things, and you may not know that I'm checking the range of motion of something while I'm talking, because I just look like I'm picking up a leg, you know, but almost always it's really hard when people say just check him and see if he needs anything. But actually what we're doing is we're checking something, and then if we find something abnormal, we fix it at that time. So at that point in the exam. So I'm not going back and checking and fixing things. I'm fixing them as I'm finding them. And everybody has a different way that they're going to go through this. But, you know, I think the most important thing is that it's the same every time, so you don't miss things. You know, if I get off of, and I'm like that about everything, my lameness exams, I have to start on the left front. If I forgot, help me if I start on the right front. Then I'm out of order and I don't know where I am. You know, so just to have, you know, a complete method where you make sure you check everything. So we're going to look at the vertebral bodies. I'm short. I have to stand on top of things to do that, because I have to make sure I'm far enough on top of them that I can feel the range of motion. You know, other people are nice and tall. They don't have to do that. You know, dependent, and this is where I think whether you're seeing a veterinarian who's trained in chiropractic or a chiropractor who's trained in animal chiropractic is a little different. You know, a veterinarian can definitely do a thorough orthopedic exam. A chiropractor may refer you to someone for an orthopedic or neurologic exam, because that's not their area. So we're going to test the range of motion, and that's back to what we call that motion star, which is, are you within the normal range of motion of all the parts we can touch? You know, starting with the central nervous system, the brain and spinal cord, and moving to the extremities. Because what you find is that frequently, if you fix things in the neck, the head, the neck, and the back, the other things fix themselves. So, again, we're looking at the relationship between two adjacent vertebrae and are they moving correctly. And that's when they're, if you guys have seen it, we're sitting up there and we're just going down. You know, that's what we're checking. We're motion palpating. So we're gonna see more commonly, is there not enough mobility? And every once in a while, there'll be too much mobility. But either one of those things, you know, can be a problem. Far more commonly, we're gonna see hypomotility, not enough. It's really funny, I was adjusting a young horse yesterday, a 3-year-old. I was like, oh my God, this is amazing, you know, because she moved so much, you know, and I don't, you know, more of the horses I'm seeing are older performance horses that were just kind of trying to keep duct tape together to keep doing their job, you know, and it is truly amazing the difference between the mobility of a younger animal and an older animal. And then our other horse was a standard bred that, you know, was a rescue that raced, and that thing didn't move at all. And I was like, oh, this is, you know, this is incredible. So, motion palpation is how we make a definitive diagnosis of a vertebral subluxation complex in an animal, okay? So you do want someone to go through and touch as many parts of your horse as they can. So what types of things are we finding? You can have macro trauma, which is like you're not gonna not notice it. It's the horse fell in the indoor ring while you were lunging it or chasing it, or he went through the fence, or he got in a trailering accident. It's usually something severe, sudden, and nobody's wondering. You know, it's immediate. You find an abnormality, okay? So that's, or microtrauma, which is what we see more often, right? Chronic abnormalities over time, daily activities, repetitive use, you know, and in looking, you can almost say where horses are gonna have abnormalities based on their discipline and use. So, for example, upper level dressage horses, they want a higher head carriage, so their head is set on their neck is set on their chest higher. They have overflexion at the poll a lot of times. They have poll abnormalities. They have lower cervical problems, and they have lumbar problems. Almost guaranteed. Plus or minus an SI in there, you know, things like that. But depending on the use of the horse and the way they're asked to carry themselves, you can almost know what the problem is, because it's also the phenotype, right? You want big warm blood dressage horse with its head set on here versus a reining horse, which is going to be shorter, lower head set. You know, they're going to have SI problems because they come up underneath themselves. You know, it's actually really, the physiology of it's awesome when you think about it.
What about jumpers?
So jumpers, you see a lot the same of the upper level dressage horses, because again, they want a higher headset, you know, a lot of SI problems from pushing off, lower lumbar. Very frequently, I also see a ton of saddle fit problems in every discipline, you know. So, you know, thoroughbreds that have raced, if you look at the literature, up to 75% of thoroughbreds who have been gait trained, not broken their maiden, just been gait trained, have some degree of SI dysfunction. Hands down, they've done studies on it.
I have a question.
Yeah.
I was talking to someone, we were having a discussion about it, and we're talking about the hocks. A lot of people think they have the horse has hot problems, but it could be actually in the SI joint.
It's a chicken egg thing. You know, hocks are easier to treat. We can inject them. SIs are a more nebulous thing. I mean, we can inject SIs too. It's more complicated. You know, so it's also more socially acceptable to inject hocks, right? So people are more, I do a ton more chiropractics than acupuncture because chiropractics is more socially acceptable.
What would be
You know.
the difference between the two? Like you assess a horse and decide, I think chiropractic would do better than the needles.
It depends. Most of the time I do what I'm asked. So if you called and asked me for a chiropractic appointment, that's what I'll do. If you call me for an acupuncture appointment, that's what I'll do. I almost always run the acupuncture points on my chiropractic patients because that gives me an idea. And then commonly I'll adjust them, come back and run the points. And if I haven't done what we call cleared the channels, then I will go back and stick some needles in to try to get rid of whatever I have left. So it kind of depends on what somebody asks me to do, unless I feel violently in the other. You know, some of the horses that are super back sore, I'd rather acupuncture them than adjust them to get some of the myofascial release, and then come back and adjust them.
Do you ever get like extraordinary results on the first try? Like it's very surprising.
Absolutely, yes, I do. That's not typical. You know, most of the horses I'm treating are not a one and done deal, you know, because they've had chronic dysfunction over time. Now the 3-year-old I did because she's like, I just want to keep her happy. And I was like, yeah, I love you. You know, do I need to do her again? No, probably not. Not until she said, I said, let me know when we come back for the other one. We'll take a look. If you feel like she's not traveling right or something's going on, we'll adjust her again. But, 3 or 4 months. Because she's young, she's still athletic, she doesn't have problems. I have a horse that has horrendous navicular, and the owner only wants to treat it homeopathically. And I actually get kind of annoyed because I adjust the horse and it does well, but she won't change its shoeing, and she won't put it on medication, and she won't inject its coffin joints. So I honestly wish that horse didn't respond quite so well because I don't really think it's fair to the horse. Because all I'm treating is the symptom. I'm not treating the underlying disease in that horse. But it works for him. I just don't think it's necessarily should be the only way you treat things. And that's the difference between, and I say this a lot, is I'm a veterinarian first. So adjusting your horse that needs its hocks injected might make the horse feel better. But unless you fix his hocks, you're just going to get back to the same thing because they're going to be compensating the same way. They're going to be doing those things. You still have to treat the underlying disease. Now, maybe it would get you more time between injections because then he's using himself properly, But there's versus chiropractors who want to fix everything with chiropractics because that's what they do. I think there's some happy medium, in between. And I have a horse that was in a trailering accident and she called me for chiropractics and I will not adjust its neck. I've seen his x-rays and I'm not doing it, And he's actually responded fantastically to acupuncture, but, we had to have a talk about it because I don't think it's safe. So we can have abnormalities again that directly, like a pinched nerve in us, lead to dysfunction, or the micro problems which lead to time over time. So you can also have, if you have indirect nerve trauma, so it affects mechanoreceptors, which are what tell your brain how to use your muscles effectively. And if you hurt those, then you're hurting muscle, then you're hurting soft tissue. It's a giant spiral of body dysfunction that leads to more problems. So we are not even your human chiropractor, is putting your bone back into place. what we're doing is a very specific short lever, which means, so if it's long lever, you're using the long side to launch something versus short. So it's a short lever, high velocity thrust in a specific place in a certain line of correction. We're putting an input, a quick, fast, abrupt input into the nervous system, and then asking the nervous system to tell the body to correct itself. Nobody's pushing a brake, you know. I have a fantastic trainer, and he went to Mississippi, and he said, why don't you use the mallet? The guy in Mississippi uses the mallet.
Oh.
And I finally looked at him and I said, the only person I think I'm going to use the mallet on is you. So, you know, there are different ways to do that. Some people will use the activators, which is the little clicky thing. Some people do use mallets. I'm not really a fan of that method, but you know, if you know how to use something appropriately, but nobody's putting a bone back into place, we're putting input into the nervous system and asking the body to correct itself. So you'll see, standing ahead, this person is adjusting an SI. You can adjust necks on the left or the right side. So again, it's very specific. The reason you need to be trained, I don't know if you've ever watched some of the YouTube videos, they'll show people knocking horses down and then adjust. No, I will not sedate a horse to do adjustment, because then I'm changing their ability to resist me. And their ability to resist me changes that anatomic barrier that it's safe to do an adjustment within, okay? So I will not sedate them. I'll sedate them to acupuncture them, but I will not sedate them to adjust them, because there's a normal resistance in your body, and if you exceed that resistance, you can hurt me. So what do we want to achieve? We want relief of pain or symptoms. We want to return to normal function. We want to prevent further problems, and we want to increase their performance. And usually we can do that, you know, within a reasonable expectation. So how often? You know, not for the 3-year-old, but for your average 12-year-old hunter jumper, probably initially I'm going to say I want to see them twice between 2 to 4 weeks apart. And then we're coming into, so I saw you got last week. I'm going to see you in 2 weeks. You're going to be horse showing all summer. I want to see you every 4 to 6 weeks to try to keep everything in line. While you're showing, you can take the winter off. You know, the younger horse, meh, when she needs it. You know, or when it's perceived that she needs it. You know, in some horses, again, when you first start, you don't know what that answer is. My idea is always to see them as little as possible, but to still be effective. Because I don't want to start over. I don't want to go back to seeing you every 2 weeks. I want to see you exactly when I need to maintain your health and not more. And I know with my chiropractor, like this time of year, I get busy, my back is killing me. If I go every 2 weeks, I'm fine. But as soon as I slack off, then things go back to how they were, you know? So there's some happy medium. Again, my idea is always to see you as little as I can to maintain a status quo level. So it is very important that you have somebody who's appropriately trained, because you can hurt them. You can exceed that anatomic barrier, you can do too much, and you can actually cause damage with chiropractic. So you need somebody who knows anatomy, neurophysiology, and biomechanics, as well as how to properly do it and properly stabilize the animal in order to be successful. Because you can hurt horses with chiropractic with inappropriate training. So proper knowledge includes you should be a DVM or a doctor of chiropractic medicine trained by a recognized chiropractic program. So there are only 3 of those programs in the US, and they will only train doctors or veterinarians or chiropractors. Part of the problem is there's no regulation on who's a chiropractor. Anybody can say they are, and it doesn't matter. So then you can take the classes, which take about 8 months to complete, and then if you can undergo an additional certification either by the International Veterinary Chiropractic Association or the American Veterinary Chiropractic Association. But those are the people you really want working on your horses because they've gone the extra mile to take a test. It was honestly the hardest test I took since I took my national boards to be a vet. And I thought, if I don't pass this, I am not taking it again. No way. But it's a 3-day test where you have to take a written portion, then you have to take a clinical portion, and you have to get above a 78% in order to practice, to be allowed to enter these associations, and you have to maintain continuing education. So ideally, you do want someone who's certified by an association, because just because you take the class doesn't mean you're certified. You have to go above and beyond to get certification, and then you have to do things to maintain that. So that way you know you have someone who's staying on top of what's going on. So, other things that you can use in conjunction with chiropractics, obviously I'm going to say acupuncture, massage therapy, equine rehabilitation is another area that's pretty up and coming. So all of this is based on a more homeopathic approach, which is helping the horse's body to heal itself. Again, if you need your hocks injected, you need your hocks injected. I inject my horse's hocks. Don't think I don't. I totally do. I also acupuncture them. I also adjust them.
Is that what equine rehabilitation is? The hock injection?
No, the rehabilitation is a program, and I'm in the middle of taking it now, which is more of similar to an exercise therapist. Somebody you go see if you had a problem, who gives you exercises, who helps you increase after you've had ACL surgery and things like that. So that's pretty much everything I have. Does anybody have any questions? Chiropractic is amazingly technical for something that doesn't seem, it's a ton of neurology and neuropathology. So,
question.
yeah.
My mare beat up my other mare, and she has cyclish.
Hematoma.
I think it's just cycloma. It was like 6 months that the doctor didn't even know that we'd be able to ride her. Is she gonna get? He said that she'll probably get arthritis. Is this something that would benefit her?
It certainly may. I guess it depends on what her actual injury is. But anytime you can get her moving more appropriately and using herself more appropriately and making her more comfortable, you have a better success at return to mobility.
So I was trying to figure out, is this something that would help her not get scar tissue? And help her.
You would, how long has it been?
About 8 months.
You need to get going.
Okay.
Because 8 months is you're well in the scar tissue. You know what I mean? I'm not saying that it wouldn't, but even returning a normal range of motion to that joint is going to be helpful. It's probably going to take longer because it's been longer. But it's, you're not done appropriately with a lot of these things, you're not going to hurt them. You might not help them, but it's not going to hurt, and even if you just like us, if you mobilize things earlier, your chance of return to active, appropriate function is higher.
And where are you from? How far?
I
do you
live travel.
Okay. Because I live near the Youngstown area.
Talk to me.
Okay.
So, any other questions about things that it might help? I mean, you can help just about anything. Again, you're with most of the that's why I like alternative medicine. I'm not going to hurt them. Might not help them, but I'm not going to hurt them. You know.